As the United Kingdom takes the first steps in the COVID-19 vaccine here in the U.S., health experts are not expecting a welcome reception, particularly in Black communities. Joy Dow shows us how they're working to build trust amid history of skepticism of the medical community.
It's a quick, painless jab, doesn't take long, quick trip to St. George's Hospital. It's been fantastic, doesn't hurt.
One British patient's enthusiastic reaction Tuesday to receiving Pfizer's coronavirus vaccine, certainly a step in the right direction for the United Kingdom. But health officials here in the United States are not expecting such a welcoming reception to the vaccine, particularly in Black communities, where there is already a deep, generational, almost baked-in skepticism of the medical community.
You believe it's going to be a challenge selling this vaccine, the safety of it in the Black community?
It shouldn't be a challenge. It shouldn't be.
Just listen to this exchange with native Harlemite Ruth Williams.
Will you take it?
You know what? I would take it when I see someone else has experienced it. See how their outcome will be.
So you don't believe that it's just safe enough for you to take straight away?
No, I don't.
A lot of studies have already shown very high rates of vaccine hesitancy.
Dr. Olajide Williams, chief of staff at Columbia University's Department of Neurology and no relation to Harlemite Ruth Williams, says increasing acceptance of the vaccine here in New York City will first require undoing decades of mistrust.
The most famous of which is the government-backed Tuskegee syphilis study, in which Black men were actually told that they were getting free medical care, but instead they were denied therapy for their syphilis, and for decades.
Now you have to get to Black communities and brown communities and poor communities where they're suspect about the vaccine in the first place. They don't believe Trump's approval process.
Dr. Williams says obtaining that approval can only begin with a sincere partnership with influencers within the Black community.
Asking community leaders, what would it take for us to increase vaccine uptake in your community, and showing these champions actually receiving the vaccine.
Well, researchers in our state are planning a statewide effort in the coming months, not only to inform minority populations, but enlist local leaders from their communities to advocate the vaccine safety. Health officials in our state are reporting more than 9,000 COVID-19 cases today, bringing the total reported positive cases to more than 1,083,000. Remember, the state does not report how many people have recovered from the virus. If you want a breakdown of the cases and the numbers in our area, you can find it on fox4now.com. The UK is warning people with a significant history of allergic reactions to not get the Pfizer-BioNTech vaccine. Two healthcare workers who received a COVID-19 vaccine during the first day of rollout in the UK yesterday suffered allergic reactions. That's according to the National Health Service in England. Pfizer and BioNTech have said there are no serious safety concerns. The final details of a COVID relief package proposed by a group of bipartisan senators could soon be rolled out on Capitol Hill. 90% of the bipartisan coronavirus stimulus bill will be completed today. That's according to Senator Joe Manchin. The $908 billion deal has been in the works for weeks, and members of Congress say it's the best chance of passing relief before Christmas. The House will also vote on temporary government and funding today to avoid a government shutdown Friday. Obamacare enrollment in our state's at an all-time high, according to Get America Covered. Sign-ups in Florida is up 32% over last year. The growth could be due to more Floridians seeking health insurance coverage amid the pandemic. Open enrollment for the Affordable Care Act ends December 15th.